Bismillah Rahman Rahim. In this video, we are going to do the spotting of the kidney. The kidney is a bean-shaped retroperitoneal organ. Its length is from T12 to L3 vertebrae, and it occupies 4 quadrants of the abdomen. Mainly, it is occupying the lumbar region, but to some extent, it is also occupying the hypochondriac, the umbilical, ठीक है जी, यहाँ पे थोड़ा सा नज़र आ रहा है ना, and the epigastric, ठीक है, but mainly it is occupying the lumbar region. Let's talk about the difference between the right and the left kidney. So the right kidney is a little lower than the left kidney. That is because of the presence of the large liver on the right side. ठीक है, and the left kidney is longer and narrower, which cannot be very well demonstrated with the help of this picture, but they say that your left kidney is longer and it is narrow and it is a little nearer to the median plane, and it is also even higher up. So that is why they say that your right kidney is only covered up by the 12th rib, whereas the left kidney is covered up by the 12th and the 11th rib, the 11th and the 12th ribs of the thoracic cavity. The transpyloric plane passes through the upper part of the hilus of the left kidney and through the lower part. No, the transpyloric plane passes through the upper part of the hilus of the right kidney and through the lower part of the hilus of the left kidney. Overall, a kidney is directed downwards and laterally. The long axis of the kidney is directed downwards and laterally. So the upper pole is actually pointing towards the medial side, or the upper pole is more prone towards the medial side than the lower pole. Talking about the upper pole, it is rather broad, whereas the lower pole is actually pointed. The lateral border on both the kidneys is convex in appearance. ठीक है. अच्छा, talking about the lower pole is actually 2.5 centimeters above the iliac crest. So this is actually the iliac crest. As you can see, this distance from the iliac crest is actually 2.5 centimeters. And the medial border of the kidney is concave. And here we have a structure which is the hilus or the hilum. The structures in the hilum, anterior to posterior, can be memorized with the mnemonic VAP. So first comes the vein, then comes the artery, and anterolaterally comes the ureter, which you can see here. The ureter. The renal artery arises from the abdominal aorta at L2 level, and it divides into many 5 segmental branches. Let's talk about the posterior relations of the kidney. So posteriorly, the kidney is related to the diaphragm, to the medial arcuate ligament, to the lateral arcuate ligament, and to a muscle that is called as the psoas major. Here comes the psoas major. It is also posteriorly related. This is actually the quadratus lumborum, this muscle. The quadratus lumborum, this muscle is actually the transversus abdominis, this one, transverse. And it is also related to some nerves and vessels, subcostal vessels and nerve. Apart from that, there is iliohypogastric and ilioinguinal. Talking about the renal vein empties on the right side, it empties directly into the inferior vena cava, whereas the left renal vein, before emptying into the inferior vena cava, it also receives suprarenal vein and the gonadal vein. This is the suprarenal vein, and this one is actually the gonadal vein. This is the renal vein. The lymph from the kidney drains into the lateral aortic nodes at the level of L2 vertebrae. Talking about the coverings of the kidney, the first covering is that of the capsule. The second covering is the perirenal fat or the perinephric fat, which fills up the extra space in the renal sinus. The third is actually the renal fascia, which is blending with the diaphragmatic fascia superiorly, and inferiorly it is blending with the iliac fascia. Laterally, it blends with the fascia transversalis, and medially, it continues along with the fascia over the aorta, inferior vena cava, and the fascia that is present over the muscles like the quadratus lumborum and the psoas major. The kidney is supplied by the renal plexus, that is an offshoot of the celiac plexus. Talking about the renal angle, which can be better visualized from the posterior aspect of the body, it is basically the angle between the erector spinae and the 12th rib. So here, if this is actually the 12th rib, and previously behind there is a muscle that is actually the erector spinae, the angle that is actually between um, the erector spinae and the 12th rib, that is the renal angle, and this renal angle can be pressed with a thumb to palpate the kidney. Or you can say that tenderness in the kidney is elicited by applying pressure over this angle with the thumb.